Now, the race for the vaccine. For years, billionaire philanthropist Bill Gates has warned about the dangers of deadly viruses. Gates has poured billions of dollars into the COVID-19 fight, and tonight he hopes in the rush to vaccinate the world, some countries are not left behind.
This will be seared in the memory of this generation, hopefully enough to invest, to be more ready next time, hopefully to invest more in all these infectious diseases that are still a huge problem. But it's almost at the level of a world war, I would say, and including the need to cooperate.
Would you then say that this has been the biggest challenge of our lifetime?
Yes. Since World War II, this is the biggest global challenge that we've all faced, even bigger than the financial crises that have come along.
Billionaire Bill Gates hasn't just been outspoken about the pandemic. He's put his money where his mouth is. Just today, the Bill and Melinda Gates Foundation announced a new $250 million commitment, bringing their total investment to $1.75 billion to combat COVID-19. Given your money, your access, your ability to just kind of rest on your laurels, what made you feel so passionate about being a part of this?
Well, our foundation is passionate about saving lives and getting vaccines out. You know, the number of children who die every year has been cut from 10 million a year down to 5 million a year. It's, you know, I'm really pleased the companies have stepped up. The plan is coming together to get this vaccine out. So, you know, it's a tragedy, but there's a lot of heroes.
The Microsoft co-founder and philanthropist had warned of a pandemic for years, even saying 5 years ago that the next epidemic could be a super contagious and deadly strain of the flu.
If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus.
Gates realized the magnitude of coronavirus before it was even identified as a pandemic.
It was in February, actually, Valentine's Day, when I had a dinner with the foundation experts, and I said, will this be contained to China? And they said, no way. It's just not possible. There's too many cases, there's too much travel. And that's when I realized, oh my God, this is going to be unique in my lifetime in terms of causing global problems. So that became a top priority for the foundation, to take this deep vaccine expertise we have and apply it to this disease.
In 2015, you gave more than $50 million to CureVac, which is really focused on this messenger RNA technology. How is that so different, and why did you see it back then, 5 years ago, that it could be such a transformative technology?
These mRNA vaccines will be among the vaccines that help end the pandemic. We've been investing in them for quite some time because they will eventually be very cheap, and you can have a factory that even once you want a new disease, you only have to change a tiny little bit of that factory to have it make a vaccine.
You know, there are moments in time that really people might credit with changing the trajectory of mankind, of humankind, landing on the moon, perhaps.
That's one small step for man.
Where does this fall, this vaccination for coronavirus? Do you feel like this is kind of part of that timeline?
Absolutely. I compare it to a world war where we had to change how we behave. We had to take huge economic pain in order to avert the many millions of deaths that, if we had just continued on, would have taken place.
A large portion of his donations have gone toward vaccine development and distribution to help ensure the vaccine is delivered to all corners of the planet as quickly as possible.
Well, there are many countries that have no vaccine factories at all, and it doesn't make any sense that their citizens wouldn't get any protection. After all, we want to end the disease everywhere, so we're not constantly having these reinfections. And if anyone cares about equity, they should not want the vaccines only to go to the rich people or the rich countries. And now we have these factories all over the world, including Serum Institute in India, ready to help out, and so that the wait for the developing countries isn't years.
Let's talk about the impact. If, let's say, 70% of Americans do end up getting the vaccine, but you see a much smaller percentage in China or India or Africa, what would that mean ultimately?
Well, we want to bring the amount of this virus in humans down to zero if possible, so that we're not constantly having to revaccinate or having outbreaks in different areas. Ideally, the whole globe would participate in this the same way that we work together to eradicate smallpox.
You've recently talked about how we might have as many as 6 vaccines by spring. Why is that so important, especially what AstraZeneca is working on? Because, you know, a lot has been discussed as far as like the specific temperature, for example, that Pfizer and even Moderna's current vaccines require.
Yeah, the Pfizer and Moderna are going to be a bit more expensive, harder to scale up, and more demanding on this temperature cold chain. The other vaccines that are only a few months behind will be cheaper, easier to scale up, and not as demanding. And I do think we'll have the global cooperation to fund this vaccine for all of humanity. The U.S. is not yet shown up to that.
An executive order signed by President Trump this week says that the U.S. will only share vaccine doses after there's enough for all Americans who choose to be vaccinated.
At least as we get into the Biden administration, the fact that we care about other people, I think that will reemerge as a priority, because the U.S. has always been the leader in these health issues, HIV, malaria. The U.S. government and our foundation are always the 2 biggest funders of these infectious diseases.
There are some people who are concerned about taking the vaccine. What would you say to them to kind of allay their fears?
You know, medicines have to be tested in trials, and there are sometimes rare side effects. The net benefit of this, if you look at the data from these high-quality regulators, is very, very high. And so I hope people will be rational about that and listen. You know, if you're in a multi-generational household, if you work at a school or a nursing home or a prison, you really owe it to the people there that you're not transmitting to them.
And what are you're kind of looking in your crystal ball, and I think you've kind of put 2022 as the deadline ultimately, or hopefully the time frame in which the whole world has kind of moved beyond coronavirus.
Yeah, the progress in the rich countries will be pretty dramatic even by summer of 2021. But for the entire world, it'll probably be out sometime in 2022 before we really get the coverage levels that we need to drop the numbers to be either tiny or zero.
Gates is now hopeful that other members of the Billionaire Club will step up to help.
I always think we could do more. You know, we should give more, give smarter. And we have a group called the Giving Pledge that brings people together. You know, I hope in the future people are even more generous.
Even before we conquer COVID, Gates is already talking about combating the next global disease outbreak. You say next time we'll be able to do it a lot faster. What will be the difference next time?
We'll have gigantic mRNA factories, and we'll be able to do mRNA at under $2 and no cold chain requirement.
In the midst of all of the darkness and despair, what gives you the most hope right now?
Just the way people have come together on this, you know, science, caring about other people. I'm very hopeful that the way we get out of this disaster sets a model for innovation and cooperation.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.